Hi, Dr. Ahmed. Thank you so much for being here with us today.
Thanks for having me.
And you said you were on call last night, so even
Yeah,
even more thanks for joining us when you're, I'm sure, exhausted.
I
Uh,
mean, we had a great birth last night and it was wonderful. So, you know,
Great. Good. That has to be so rewarding. I mean,
yeah, gives you a different type of energy. So, yeah.
yeah, for sure. Okay, so today we're talking about maybe a not great birth, and birth trauma. And so that word or that phrase can mean different things to different people. So, what are some common experiences or moments during childbirth that might be considered traumatic?
Yeah, that's a great question. And I think that we don't always acknowledge how much trauma can come from sort of little moments in birth.
Hmm.
So birth, especially if you're in labor, but even if you're not, like even if you go in for a C-section, whatever, is very different than like anything else you do in the hospital, pretty much anything else you do in life. It is emotionally charging, physically taxing, mentally, obviously can be very challenging as well. And so I think that there are little moments that people don't necessarily expect, and it's hard to prepare for. And sometimes when something happens, especially quickly, even if it's a little moment, something that you just didn't anticipate, um, it can cause sort of like little micro traumas that over time can really sort of get at you, especially when you're in a vulnerable state and it's hard to sort of speak up. There are also obviously like much bigger things that happen in the birth world that are super traumatic.
Hmm.
And you know, I think sometimes we don't acknowledge the little ones because we're like, well, so and so happened to me. It wasn't too bad
Right.
because this terrible thing happened to whoever else in your life. And so comparatively, it doesn't feel as big, but it can still sort of cause, a lot of challenges in your life and how you sort of approach that postpartum time and that new time with that new baby too.
Yeah, for sure.
So
Um,
it's complicated, I guess is the
yeah.
answer.
And I feel like I have four kids and all had very different birth stories, but that first baby, I lost a lot of blood and had to have like a blood conservation team come in. And I feel like I didn't even know how traumatic that was for me until like years later when I had another birth and I was like, oh, that wasn't how it was supposed to go exactly. Like that was kind of scary.
And I will say that like I even had stuff in my own pregnancies as much as I had been around birth and I'd been a practicing OB-GYN before I had my first. And there were even a lot of little moments for me that were like, wow, like it took me years to really, really realize how much that had an impact on sort of who I was and how I moved forward too.
Yeah. So when we're talking about kind of preparing for birth, what are some things that a mom can include in a birth plan to help prepare for maybe the unexpected or the potential for trauma?
Yeah. So I think birth plans are incredible. I think like for a long time they sort of got a bad rap that like a
Hmm.
certain type of person would come in for a birth plan and it would never go according to their plan or whatever. But I really like having a birth plan and having it early.
Okay.
And sort of especially for first times that people are approaching labor or pregnancy or whatever, there are so many little things that happen that you just don't necessarily realize are going to happen.
Hmm.
Never birthed before, if you've never been a patient in a hospital before, like there are so many little steps. And so what I have found really helpful for our patients is our hospital does a birth tour and registration.
Hmm.
And we call it a tour and registration, but it's so much more. Our nurse
Yeah.
navigators go through a big packet and go through sort of every step where there are lots of little choices and little decisions. And I like when people do that sort of late second trimester, early third trimester, or even sooner, even before they're pregnant sometimes, just to make sure that like when you're filling that out, then you can come and share it with me in the office. You can share it with the team in the hospital, and we can make sure that we're the right place for you. Because if our goals and your goals don't align, then it's going to be a traumatic situation. You're going to feel like
Right.
the power is taken away. You're not going to understand. I mean, I just had someone last week in the office who had a very different birth plan than I thought that we could accomplish for her. And we went step by step through things. And I said, this is why I think an IV is important, particularly for your history. Like, this is what
Yeah.
happened last time. This is why I think it's really important. If there's probably another place in town that might better serve your needs, but let's talk about it now before things are
Mhm.
so emotionally charged and you're vulnerable and emotional and you're in that state of having labor, making those decisions, and sort of a different state of mind. So I
Yeah.
think, like, the more prep, the better. I think, fortunately, in Kansas City, we have a lot of great hospitals. I think most of the hospitals do some version of that, um, where even before you're pregnant, if you know that,
Hmm.
like, you have certain goals for your care, like, go to that hospital. If you really want to birth in a tub, then find that place that you can birth in the tub. Like,
Hmm.
because if you find out, when you're 37 weeks that, like, your doctor's not a good fit or your midwife's not a good fit, then, like, that's really stressful and that's not going to lead to a positive experience.
And I think even from my first to my fourth, which was 11 years or something, I don't even know. I mean, so much had changed in what the hospital offered or what was the recommended kind of positions and the tools they had available. So it was even helpful, I think, if it's not your first to go through that process and just learn.
Yeah, I think, there's a lot of great birth resources in Kansas City too. There are a lot of, like, wonderful doulas, and they have
Hmm.
seen births at probably every institution, every place
Hmm.
you could imagine. And if you start talking to them about your needs and they're like, well, that doesn't really make sense for you to be going to so and so and delivering at this hospital because you want this type of birth.
Hmm.
That sometimes getting ahead of those decisions can lead to a really positive outcome.
Definitely. So when maybe things don't go according to plan, as I feel is often the case, what advice do you have for parents who are managing that stress, maybe in the moment, but then even after the fact?
Yeah. So in the moment, I think it's really hard to be the birthing parent, right? Because so much is happening, a lot is happening to you, for you. You're in this, like, really emotional state. So making sure that you have support there that can vocalize your needs and your desires and just even ask questions. Like, there's always time to answer questions. Like, there's
Hmm.
even if there's something super emergent, there's always time to answer questions. And so making sure that someone can pause and say, "Hey, what does that mean?" Or are there other options? Can be really helpful. I think that, um, one of the best things about where we deliver at Menorah is we have a model called an LDRP. So it's a little bit different from, I think, most or some of the other hospitals in town, where the labor and delivery nurses are also some of the postpartum nurses,
Oh,
which
nice.
gives you a really unique, opportunity that if something happens, the next day you may have the same nurse and they try to keep the same people together, but you can be like, so really, what happened there? 'Cause I
Hmm.
know sometimes doctors, we are pulled in a lot of different directions and we try to explain things, but sometimes it's those more quiet moments where it's like, so what was happening when X, Y, and Z happened? Why did we have to do that? And I think that, like, the follow up afterwards can be really helpful. Now, if you
Hmm.
can't get that immediately in the hospital, that's what your follow up appointments are for. If you need a follow up, get one and really try to figure out, like, what happened and why did it happen? And could something have been done differently? And if not, like, why? And I think looking into it helps. And not everyone's ready to do it right away. Um,
Hmm.
Sometimes that takes time. And obviously, therapy is wonderful.
So,
And
if a mom knows she needs help, is that something you'd recommend she reaches out first to her OB or midwife, or do you go to a therapist? Like, how do you know who to go to?
yeah, and I mean, I think that it sort of depends on comfort level a little bit. So if you have birth support, that's knows resources in town, certainly they can help if like a doula or a postpartum doula or something like that. I think all of the OBs in town, like we are pretty cued into different therapists and trauma
Hmm.
therapists. And, there are definitely some therapy groups in town and specific therapists that really sort of lean into the birth trauma and helping people process and having, healing from that situation. So, um, you know, I think everyone can help. But, if you don't know where to go, I think a good first call is always the person who helped you with your birth.
Right. And then do you think how do you walk through with moms, like maybe they did have a traumatic experience and now they want to have more babies, but I'm sure there's a lot of fear. What would you say to a mom who's in that situation?
Well, I think it definitely depends on the goals.
Right.
So if, there's a really bad shoulder dystocia, does a C-section next time makes
Hmm.
not be healing. Or if you really do want to try for another vaginal birth, would physical therapy help? Is sort of moving and managing our body a different way, is that going to help? So I think sometimes it depends on the specific circumstance.
Sure.
Um, but there's also a lot of good data that shows that even just writing out your birth story
Hmm.
can be very therapeutic. And it's, an easy, low cost thing
Yeah.
that all of us can do. And it really sort of, even just writing it down can be really helpful.
Okay. And then we kind of addressed this, but just to kind of reiterate, the role of behavioral health specialists in helping new moms heal or prepare for, the next birth. Um, how can, what would you say to a mom? Just how can they seek help if they know they need it?
Yeah. And I think this is like the one of the positive things that came out of sort of the COVID lockdown situation is there are so many more resources. There
Yes.
are resources online, there are places you can call. I think really finding someone who sort of specializes in healing from birth trauma, like not just any therapist, not your therapist
Hmm.
has helped with, your anxiety or something else, but someone who really sort of understands the birth process and
Hmm.
understands sort of that, power can be taken away and how to sort of get that back. So, yeah, I think postpartum.net has a lot of resources, but again, we are so fortunate that in Kansas City, there are like a handful of people that really lean into it and really like work at helping each other and helping moms in Kansas City.
That's awesome. Any final thoughts just in thinking about birth trauma and talking to moms?
Yeah, I mean, I think the other thing that like what we can do from our perspective as sort of doctors, midwives, things like
Yeah.
that is realizing that like I feel like sometimes we think that birth trauma is like a fault of someone when in reality it's like stuff happens. Not
Hmm.
great stuff happens.
Yeah.
But like your birth wasn't traumatic necessarily because somebody did something. And it's not like a fault, but it's like our job too to help people feel better and to help people sort of fix what happened and move forward and, have healthier things happen in the future. So like, I feel like sometimes doctors like we shy away from the word like traumatic birth
Yeah.
because we feel like they're saying it's a fault of someone, but it's nobody's fault. It's just, something terrible happened or something that needs to be worked on for next
Perfect. Well, thank you so much for your time and for all you do for moms in Kansas City.
time.
Um, HCA Midwest Health hospitals deliver more babies in Kansas City region each year. You have 4 labor and delivery hospitals across the Kansas City area and make it convenient to receive exceptional pregnancy and childbirth care. And you can visit hcamidwest.com to find a doctor near you. So thank you, Dr. Ahmed. I really appreciate your time and hope you get some sleep.
Thanks. Me too.